you're welcome back once again to my channel. If you're seeing my face for the first time, this is Tina Isoa. Where have you been? You're welcome to the channel, okay? So guys, a lot of you have been asking me, but before then, please subscribe if you haven't subscribed to this channel. Subscribe, turn on the notification bell, and join this amazing family. Do not forget to give this video a thumbs up, because definitely you're going to like it, love it, and enjoy it. And at the same time, please share. You never can tell who you'll be helping around you, okay? And a lot of you have asked or requested that I have a section with them, and right now I'm at Bridge Clinic, Port Harcourt, River State, and so many of you sent me questions that I don't have the professional background to answer, and I have scheduled this chit chat with them, and I'm here with Dr. Femi Oluwa. Please introduce yourself.
Okay, my name is Dr. Tambari Femi Oluwale. I'm a fertility physician at the Bridge Clinic in Port Harcourt. I've been at the Bridge Clinic for about 4 years, and I've been in medical practice for over 10 years. So that's what I do.
Okay. In case if you don't know, I have 3 amazing children. God blessed me through IVF in Nigeria, in this Bridge Clinic, and hence I decided that I have to come out and be sharing my testimonies, which have attracted a lot of persons towards opening up about IVF in Nigeria. And like I said earlier, a lot of you sent me questions that I will be asking her, and I've asked her if she grounded enough to give us the answer, and what she told me is yes, I should shoot. So I'm going to shoot the shots, okay? Guys, I hope you enjoy it. The first question I'll ask, okay, tell us about Bridge Clinic. Tell us about overview about Bridge Clinic.
Okay, so Bridge Clinic is a fertility clinic based in Nigeria, founded in Nigeria. It started over 20 years ago. Actually, started in 1999. And Bridge Clinic has branches in Lagos, Abuja, Port Harcourt. It's basically a fertility clinic, so that is our specialty.
Okay. So there are, I know there are so many reasons people find themselves into seeking for fruit of womb, that is infertility. And since it's just a fertility clinic, of course you must have like a rate, number of people who come in with one reason or the other. But which is the most common problem that people come or couples come with?
It's actually quite interesting, because yes, infertility is what we're dealing with, but when you look at the reason why couples come in, or the reasons why people have fertility challenges, it's actually divided into 3. 1/3 of it is actually because of male factor, 1/3 of it is actually because of female factor, 1/3 of it is actually from the couple. But when you look at, or you bring it down to our setting in Nigeria, for the females, you'll be looking more at things that have to do with tubal issues, so blockage of the tubes. And for the males, you'll be looking at sperm problems. Okay, so semen, either the semen is low, or you might not have sperm at all. So these are the common things that you'll actually see. Of course, there are a lot of other situations where the couples might have challenges, but these are the commonest things.
But here in Bridge Clinic, which is the most commonest reason for couples coming to assess?
That's actually, those are actually the commonest reasons.
Not all of them are they're on the same level, is that what you're saying?
So I'm saying for the
percentage.
For the women, you're looking more at tubal issues, so blockage of the tubes. And for the men, you're looking more at poor sperm parameters. We tend to see more women, because women actually would want to show up, and in the society that we find ourselves in, unfortunately, the woman is looked at as the cause most times. So the woman is usually the first person to seek care, and so the women tend to come in more than the men. So you will see more women than men. Yes.
Okay. Another question I would want to ask personally: who needs IVF? Is it like everybody can come in for IVF? Who particularly needs IVF procedure?
So when we talk about IVF now, we're talking about in vitro fertilization. So that means you're fertilizing the egg with the sperm outside of the human body, so in the lab. So, but you're mimicking the process that happens in the body, right? Now, IVF, you can't tell if somebody needs IVF until you've properly assessed that person and found out what the problem is. Some problems may have reversible causes or modifiable causes, but some problems don't have modifiable causes. So if you find out that these causes might not be modifiable, and the couple may not be able to achieve pregnancy in the bedroom, then you now talk about let's go to IVF. Now, if a woman has 2 blocked tubes, okay, maybe I should go back and start from how does pregnancy happen. In the normal body, right, in the human system, you have the uterus, all right, and you have, as the body of the uterus, like imagine an upside down funnel or just a funnel standing. At the bottom of the funnel, that's like the cervix, and that's what you find at the top of the vagina. So if there's a sperm released into the vagina, it's supposed to swim through the vagina, into the uterus, out through the fallopian tube, okay? And in that fallopian tube, that egg that has been released by the ovaries at the other end. Yeah. So that egg actually meets the sperm in the tube, and then they continue the journey into the uterus. So they're coming back now. So if you have blockage of those two fallopian tubes, it means that the egg and the sperm, they don't have anywhere to meet. Yes, and so there's a blockage, and then we need to have a way for that egg and sperm to unite. And so that unionism is happens in the lab, but that union happens in the lab. Okay. So once there's that challenge, there has to be IVF. Some people will have one tube blocked, the other tube open, and with that one tube blocked, other tube open, you can actually still work on the one with the one that is open. The other absolute reason will be where the sperm parameters are poor, or where there is no sperm at all. If the sperm numbers are too low, or if the movement of the sperm is also quite poor, then it means that the sperm cannot get to the egg successfully, and so we are likely to need IVF. There are other, little causes where IVF will be an advantage, but these are absolute causes or absolute reasons why people need IVF.
Okay. So now let me go into the questions. I think the earlier questions were just peripheral, knowing about IVF and all that. Now let me go straight to the pressing questions my subscribers asked that I should ask you. The first question I have here is, how can one achieve successful IVF procedure?
Alright, so one thing people need to understand is that in the bedroom, when you're trying to make a baby, where you're trying to achieve conception, the chances of a young couple, so a man and a woman, say in their 20s without any issues, actually achieving pregnancy is about 25% a month.
Wow.
Yes.
It's poor.
Yes, this is natural conception.
Yeah.
So when you see people that seem like they're getting pregnant every time, it's wonderful, but the chances for a regular person is not that high. Now, as the woman grows older, this chances goes down. By the time the woman is 40, it's about 5%.
Wow.
So let's bring it over now to IVF. In IVF, you have advantages. What are the advantages? You are getting out more eggs. You can look at the quality of the eggs and say these eggs are good eggs. You can look at the sperm and say this is a good sperm. When you put the egg and the sperm together, you can say this is a good quality embryo. So you're putting it right in the place where you want it to be. So these are the things that can improve your chances when you're doing an IVF cycle. However, we are not in control of what we call implantation, which is when the fertilized egg or the embryo actually is supposed to get. So because we are not in control of that, you have some advantages by virtue of the things that you've done in the lab, but you are still not in control of everything. So average IVF success rate worldwide, let me shock you, is actually about 35%.
Wow,
yes,
35?
Yes, it's actually about 35%. So that tells you that there are a lot of IVF cycles that will fail, and there are some that would actually also work. But the average woman will need between 3 to 5 IVF cycles to achieve one success.
Wow.
Yes. So when it comes to things you can do to achieve successful IVF on your own part, I mean, I'm sure if your doctor will give you like some advice, but it's the same thing we say for most other medical conditions. You want to eat healthy, okay? Eat healthy, ensure that you're maintaining like an optimum weight. Let your body mass index be between 18 and maybe 30. Okay, you don't want to be underweight, you don't want to be overweight, and just follow your doctor's instructions, because they are looking at each person. Everybody will not have the same advice across board. Everybody's situation is different. So general health is important, but then of course just follow your doctor's instructions.
Okay, the next question is there any drug to thicken the endometrium for a successful embryo transfer?
So the answer is yes, there is a drug. Okay, so the way the endometrium works, the endometrium is the inner lining of the uterus, and that's where the fertilized egg, the embryo, is supposed to go and sit. So before embryo transfer, depending on the kind of treatment cycle you're doing, if you're doing a fresh treatment cycle where your eggs are going to be collected in that cycle, the drugs that are being given to you to stimulate the growth of those follicles on your ovaries are actually also helping to produce the hormones that would help to thicken your endometrium. Yes. So the follicles that are developing are also producing estrogen, which is basically what you need. And that estrogen is actually going to thicken the endometrium. So when you are doing your scans, the doctor will tell you, oh, your follicles are looking nice, they're developing nicely, and your endometrium is also developing nicely. These two things are important. If you are doing a frozen embryo transfer cycle, so you've had your egg retrieval in the past, the sperm has been injected into the egg, you have your embryos in storage, and now you're coming back to put in your frozen embryos. Because you don't have the natural process of ovulation and those hormones that will help you, because after ovulation there's also progesterone secreted from the corpus luteum, which is the remnant of the follicle. We're going to be giving you these hormones, by tablets or by insertion or by injection or by whatever it is. So there are hormones. Typically we will give estrogen during the frozen embryo transfer cycle to thicken the endometrium and monitor the endometrium to ensure optimum thickness before we put in the embryos. If it's not thick enough, then there might be another problem that has to now be solved.
Which I actually experienced. I think I shared it here. One of the cycles, I think that was when I came back and wanted to use the cryopreserved embryo. The endometrium wasn't increasing, and I think one doctor here, after series of research, probably calling the other branches, advised that I should use estrogen patch.
Yes.
And that did a miracle for me. I guess the person that asked this question, this is what you want to hear. She has just mentioned it, but I just want to break it down. Estrogen patch did the miracle for me. So get the answer has been given. Then the next question I have here is something that I know a lot of people, a lot of my subscribers have chatted me up about this. And the reason being that we know dollar rate and the conception IVF, a lot of people based abroad want to do this IVF, and they are always asking me, they don't have time, they can't come back home, spend 2 months rather. Like when they want to find out about my experience, I tell them you have to take injections, you have to do this, you have to and they don't have that time. Depending on where they work, they don't want to lose them. So the question they're asking me here is that, can they start IVF procedure with Bridge Clinic while abroad and come back home to either go through the embryo transfer and egg collection and all that?
Okay, so yes, the answer is yes. Okay. But it's not as the yes is not as straight as. Okay, so I'll explain why. For most people, the average IVF cycle is about 6 weeks. Okay, for most people.
Okay.
For some women who are blessed by God and have a larger store or volume of eggs on their ovaries, their treatment is a bit longer. And this is because the most dreaded complication of IVF is something we call OHSS, ovarian hyperstimulation syndrome. And to reduce the risk of that OHSS, these women's treatment might have to be split in two, meaning that you have to stimulate, retrieve the eggs, inject with the sperm, and freeze the embryos. Then the woman needs some time to kind of get herself, and then she comes back after a while for a frozen embryo transfer cycle. So this is a longer period of time. So what we do for our clients overseas is, even before COVID started, we will do virtual consultations. So you can do a consultation on Zoom, you can do a consultation on WhatsApp or telephone, and then what happens is after that, we send you the tests you need to do. So we have an idea of where exactly you stand. We can do these evaluations, you do your test, blood test, you do your scan, the organ of the semen analysis. So when we have these results, then we can say this is the diagnosis and you need IVF or you don't need IVF. So when we now decide you need IVF, depending on what kind of treatment protocol you're doing, you might need to now come in, and then when you come in, we can start. Some people would actually have some of the medication there, like the initial down regulation with glucerolin. So that buys you about maybe 1.5 to 2 weeks. So it shortens your 6 weeks a little bit. And the assumption is that, or the hope is that, while we are doing the treatment, you are responding accordingly. Because some people will be on the glucerolin, you see your period, we expect that, when you come in, we do your scan, your endometrium is thinned out, and then we find out that, okay, we are not getting what we want, so we have to extend. And so because of these unpredictableness sometimes, or unpredictability of the treatment, it might make the person stay longer. But if everything is going according to plan, you can actually start a few things over there that will save you some time. And then you can
I know what basically what you're talking about is that transvaginal scan of knowing that everything is moving out, moving accordingly. But can't they do that and be reporting to you guys?
And for now, no. So your initial transvaginal scan, that's the assessment. You may be able to do it there. Do you understand? And then let's have an idea of what is going on. But then when you come in, what we do is you come in just before your first scan. So you start the injection and then come in, because we want to have an idea of, okay, what's going on with you as a person, our own physical examination, and then we can. So you don't really want to leave it to chance. Unfortunately, because of the way things are in Nigeria, we tend to want to cross-check, also because of our quality management system. So you want to cross-check everything. And so yes, we want you to come in so that we can have an idea of what we're dealing with before we now proceed.
That brings me to the policy management she just mentioned. Why is international standard, policy, and management so important to Bridge Clinic?
It's important to us because it helps us to stand out. That's the short answer. Okay. Now you want to be able to relate to your peers overseas on the same level. And the reason why a lot of people go overseas is because they feel that the quality they are getting cannot be gotten here. We want to change that narrative, and we believe that we have been able to change that narrative. For clients or for who have treatment overseas, we've been able to relate with even some of their clinics, and there's this collaboration. So you have your embryos overseas, you want to ship them down. They want to know that where they are shipping the embryos to are actually able to, or is actually able to handle these embryos to the best of standards. And so the quality management system is very, very important. This process is also a very delicate process. You don't want things happening in a way that shouldn't happen, because it can negatively affect your cycle. And so you have a process where you are watching or monitoring everything with hawk's eyes. You have standard operating procedures, so everybody is doing things according to book. You have an ISO certification that is ensuring that things are international quality. And if you do have an incident, then it is reviewed, corrective action is taken so that this doesn't happen again. And that's very important. As part of our policy, honesty is one of these things. And so when there are mistakes, we have to come back and tell you that, okay, maybe this thing happened and it shouldn't have happened this way, and this may be one of the reasons why that happened. But this is why the quality management system is important, because you keep improving on your practice.
So guys, I don't know if this video is long. If it's extremely long, we are going to do it part 1 and part 2, okay? So I just said, let me say that so that you would expect part 2. Even at the end of the part 1, I will tell you expect part 2. But let's